Hello from Chiang Mai and RB, Renal Disease and Biotechnology meeting organized by Professor Dusit Lumlertgul. We are going to take a cappuccino with Nutta, the Lumlertgul, and Professor Marlis Osserman. Thank you very much for joining.
Thank you.
Ciao mondo, hello world, hola mundo, konnichiwa, ni hao, namaste. And possibly, how do we say in Thailand?
สวัสดีค่ะ
Sawadika. Fantastic. We're here in Chiang Mai, Thailand, and I am with Nutta Lumlertgul, which is also the daughter of Dusit, an old friend who organized now the 10th edition of the RB 2024, which means Renal Disease and Biotechnology for Blood Purification, in an historical meeting in Chiang Mai, discussing different techniques and renal disease in intensive care. So Nutta, you have been fellow abroad and now you're back in Thailand and you will speak about apheresis. So what is your story and what is about your speech here?
Yes, so I am a consultant at King Chulalongkorn Memorial Hospital in Bangkok, Thailand, and I spent 2.5 years in London doing research and clinical work in intensive care with Professor Marlis Osserman. And today I'm going to talk about apheresis in critically ill settings. So as a nephrologist, we can also help with multi-organ disorders. We can help by doing apheresis, which means taking something that we don't want away. And there are many different techniques, either by centrifugation or membrane separation. And as nephrologists, we can help setting up membrane separation to do plasmapheresis in ICU. And not only can we do plasmapheresis, we can also combine plasmapheresis with other organ support. We can combine plasmapheresis with ECMO machine, with heart lung machine, with dialysis machines, or with adsorption.
Right.
Yes, and there are many indications that we can do plasmapheresis: neurological diseases, hematological diseases, kidney diseases, or acute liver failure.
So what are your 3 top indications for apheresis?
My most common consultations to do apheresis in ICU now is acute liver failure. And we do plasmapheresis as a bridge to recovery or liver transplantation. And my other indications are immune conditions for renal diseases, recurrent glomerular disease after transplantation, or in patients who are about to get kidney transplantation and they have a very high risk of rejection. And I also help with TTP and neural conditions such as inflammatory dilating polyneuropathy.
So it's particularly interesting that extracorporeal blood purification is now today not anymore limited to dialysis, but many other techniques. Apheresis is one of them, and it's interesting the possibility to associate apheresis with ECMO, with adsorption. We have heard in this meeting about a double plasma molecular adsorption system, DPMAS, in case of liver disease. I think it's a completely new horizon of therapies that may help intensive care patients and critically ill nephrology patients. So thank you very much, Nutta, and we have our cappuccino here in Chiang Mai, Thailand. Thanks for joining. Excellent.